One of the most common surgeries that we perform is to repair the cranial cruciate ligament in the dog.
And the cranial cruciate ligament is similar to an ACL in people. It helps to stabilize the knee and keep it from having movement during a regular walking or running motion.
In the human knee, the femur rests on a flat tibial plateau. The dog knee, however, has a very fundamental difference, and that is there is a slope to this bone, or an incline, of 20 to 30 degrees. It's the cranial cruciate ligament inside the knee that acts like a rope that prevents the femur from sliding backwards.
What happens when the CCL ruptures is that the tibia will move forward and relative to the femur, and that little instability, that movement causes pain and discomfort. So one of the things we always do when we do knee surgery for a torn cruciate ligament, be it a TPLO or an MRIT, is we always evaluate the inside of the joint, including the meniscus.
If we lift the femur off and we take a skyline view of the tibial plateau, the meniscal cartilages are shaped like boomerangs. The outer meniscus is attached to the femur, so as the femur slides backwards, that outer cartilage moves with the femur and rarely, if ever, tears. The inner meniscus, however, is the problem child, because the inner meniscus is attached to the tibia with a small ligament and is fixed in position. So when the femur slides backwards, it will go over the back portion of this cartilage or meniscus like a steamroller, and many times the back portion of this cartilage will tear. So when we are in the knee, it's very important to identify this tear and remove any torn cartilage. This cartilage will regrow in 6 to 9 months in the dog. If, however, we find that the cartilage is intact and not torn, we will cut that little ligament to perform what we call a meniscal release and allow the meniscus to get out of harm's way.
Essentially, if the meniscus is not addressed in some way, shape, or form, you can have a dog that recovers well initially, then develops a late meniscus tear and becomes lame again, and we try to avoid that whenever we can.
Following exploring the knee, we then need to perform a technique that will stabilize your dog's knee. In large breed dogs, the procedure we will perform to stabilize the knee is a procedure called TPLO. It stands for Tibial Plateau Leveling Osteotomy. The idea behind this technique is if the femur is a ball sliding down a hill and we don't want the ball to slide anymore, we need to get rid of the hill. In order to do that, we make a specialized cut in the bone. So with a specialized saw, we will actually cut the tibia below the incline. We will then rotate that bone so it is flat. And by doing this, we actually eliminate the slope of the bone. And now the femur is resting on a flat surface. Again, if you have a ball sitting on a flat surface, pretty much the same as the human knee, a ball on a flat surface does not want to roll. So by performing this technique, we have not replaced the cranial cruciate ligament, we have actually eliminated the need for a cranial cruciate ligament at all. Once we have rotated the bone and placed it in its new position, we need to stabilize the bone so it can heal in that new location. In order to do that, we place a stainless steel plate on the top of the tibia with screws above and screws below, and that plate will stay in permanently unless it causes any problems to allow the bone to heal in its new position.
After the surgery, the dog needs to be rested for about 10 to 12 weeks to allow the bone to heal. There really is no more instability immediately following surgery, but the bone needs to heal.
Expect some swelling and bruising of the limb. If there's any discharge at all from the incision, you need to let your veterinarian know. Following the 1 week recheck, you will then be able to start actively leash walking your dog, starting with 15 to 20 minutes a day and increasing by 5 to 10 minutes per week. You'll then return for reevaluation with your veterinarian approximately at a month, 8 weeks, and then at 12 weeks. At the final recheck in 12 weeks, your veterinarian will take an x-ray of the limb and make sure that everything is healed. That x-ray will then be sent to us, we'll evaluate it, and then you'll be able to return your dog to normal activity a week or two following this.
The nice thing about this procedure is it's very reliable. It leads to excellent outcome and function long term. Essentially, the dogs go back to normal activity with no residual lameness. And once the tibial plateau is leveled, there's truly no failure of the construct.